All right, welcome to Good Food Unearthed's YouTube channel. Today we have our guest is Dr. Hana Kahleova. She is the head of clinical research with the Physicians Committee for Responsible Medicine in Washington, D.C. Welcome, Dr. Kahleova.
Hi, thanks for having me.
So one of the things that I love about studying nutrition is discovering how intelligent and complex the human body and the food that we eat every day are. And when we eat, like say an apple, there are a myriad of mechanisms that are affected throughout the digestive tract and then within the body itself as nutrients are shuttled to where they need to go. And we really seem to have a diverse universe wrapped up inside this shell of skin and muscle and bones. And today I'd like to talk about how truly magical a whole food plant-based diet could be and try to see if this is really the magic pill that everybody is looking for. So Dr. Hana Kahleova, I wonder if we could talk about some of your research and what you found, what mechanisms are affected by eating a whole food plant-based diet. And maybe we could start with weight loss and how that's affected.
Yeah, it's amazing to see how many weight loss diets there are on the market. And, many weight loss diets work only short term. And at the end, they slow down your metabolism, so you regain even more than what you've lost. So obviously, we're not interested in any new diets, like this, that would just make things worse. Prospective studies have shown that people consuming vegetarian diets or even vegan diets who avoid all animal products are leaner than non-vegetarians. The lower the animal product consumption, the lower the body mass index, and the lower also the risk of getting diabetes. And when we look at the randomized clinical trials in the treatment of obesity and overweight, we see that plant-based diets lead to a greater weight loss compared with diets that are equally hypocaloric. So even if people are consuming the same amount of calories, they will be losing more weight on a plant-based diet compared to on another hypocaloric diet. Now, why is that, right? How is it even possible? If you eat the same amount of calories, shouldn't you be, losing the same amount of weight? Well, calories are not created equally. So it also depends on your dietary composition. One of the explanations is a low caloric density of most of the plant foods. For example, if you eat 200 kilocalories in the form of raw vegetables, you will completely fill your stomach compared to the same amount of calories eaten in the form of meat or in the form of some kind of fat that will only fill you up a little bit and you will still be hungry. So plant foods have a lower caloric density and provide more signals for our stomach for satiety. Another mechanism that's involved is stimulation of brown fat. Some foods are able to stimulate brown fat and lead to an increased thermic effect of food, which is the release of energy in the form of heat when we ingest a meal. And it has been shown that when people switch to a whole food plant-based diet, their ability to increase the release of energy in the form of heat after a meal increases by about 16%, which is a lot because it's after each meal. And in the long term, it may play a key role in weight management.
Right.
Another mechanism that may be involved is gut microbiota composition. There's good guys and there's bad guys in our gut. People have a different gut microbiome diversity in different parts of the world. In rural Africa, people tend to have richer gut microbiota composition compared with people living in Western countries. So one solution may be to move to Africa, or just, take our lessons from their diet that they're consuming, which is a very much plant-based diet. But it's not only about the diversity and the richness of the gut bacteria, it's also about the relative content and the different ratios between Bacteroidetes and Firmicutes, for example. There was one study conducted in school children living in Africa and comparing them to children living in Europe. And the children living in Africa had a higher content and higher ratio of Bacteroidetes to Firmicutes, and particularly their Prevotella relative content was the highest compared to children living in Europe whose Firmicutes had a higher proportion.
Mm-hmm.
This ratio between Bacteroidetes and Firmicutes is important for our cardiorespiratory fitness. So if you go to the gym, about 22% of your performance in the gym may be explained by your gut bacteria composition, by your Bacteroidetes to Firmicutes ratio. So it's a really important aspect of health and plays a major role in weight management, but also other aspects of our overall health.
Yeah, it sounds amazing. There's so the energy density, the satiety factors, the gut microbiome, all of that converging together, and it's just a whole food plant-based diet, which is just whole grains, legumes, fruits, and vegetables. I wonder if we could talk a little bit about going a bit more specifically into type 2 diabetes and what mechanisms are affected there.
Yes, that's an excellent question. So for a long time, we have thought that, in type 2 diabetes is only about insulin resistance. But nowadays, we know that there are at least 8 organs that are involved in the development of type 2 diabetes. One of them is our gut. When we ingest a meal, hormones that are called the incretins are released from the gut that stimulate insulin secretion. And this insulin secretion, this incretin effect is diminished in type 2 diabetes. And it's a two-way street. If you have your incretin effect diminished, this increases your risk of getting diabetes because you will not be able to secrete as much insulin after a meal. But also vice versa. If you have type 2 diabetes, this further diminishes your incretin effect. And we have done one particular study where we compared 2 sandwiches. One was a vegan burger, veggie burger, and the other one was a processed meat and cheese containing burger. And both of them had the same amount of calories, and both of them had the same macronutrient composition. And what was amazing to see that the incretin secretion after the meal intake increased in response to the veggie burger. And people are also reporting to be more full. They reported greater amounts of satiety compared with the processed meat burger. So in other words, a plant-based meal may improve the incretin secretion, and the effect may be comparable to an effect seen in some drugs, such as sitagliptin. Gliptins are drugs specifically developed to treat this condition. So that's how plant-based foods are powerful, in treating the disease. They don't only treat the symptoms, but they treat the underlying cause.
Right. And I guess, does that sitagliptin have any side effects to it?
Yeah, as you mentioned, all the drugs that are available always have side effects. So it's wonderful to have options. However, if we discover after 10 years that the drug that has been used for treatment of diabetes is cardiotoxic and people are dying of more heart attacks, then it's always a disappointment, and it's just a matter of time. Each drug has some side effects. So the dietary change is a natural way how to treat the condition. And the only side effect you're getting that you're getting more healthy, overall, you're improving your health. Not only your diabetes, but also cardiovascular health, and you are decreasing your risk of cancer, and so on.
Right. I guess one of the interesting things that I've found in researching this is that type 2 diabetes seems to be can be described as a bit of a survival mechanism where you're taking in, I guess, too much energy, or energy that's blocking up the works in some way. And then there's a feedback loop, like you were talking about depressed incretin, which then suppresses or causes insulin resistance, and how that's a two-way street, kind of. I wonder if that seems to make sense.
Yeah, type 2 diabetes is a survival mechanism that's supposed to help us, survive the times where there's scarcity of food. Mm-hmm. However, we live in abundance, so our problem is the opposite right now. Right. And we better change our behavior because, with the same genes, you can trigger the genes through your behavior, or you can just have them silent. The same genes, for example, if you have genes that cause you to be less able to get rid of the waste in your lungs, if you smoke in addition to these genes, then you have a real problem. You will not be able to get rid of the smoke, and this will increase your chances of getting lung cancer. However, if you don't smoke in the first place, you don't need to worry about if you have these genes or no. And it's very similar to genes for diabetes. They are not, these genes are not as decisive. It doesn't mean that if you have one gene running in your family for diabetes that you have to get diabetes. They have more a supportive role. There are many genes involved, and the good news is that we affect the expression of these genes through epigenetics, through the diet that we're consuming, and through our lifestyle choices.
Right.
So we better make healthy choices, not to trigger the genes that put us at risk.
Yeah. I wonder if we could also talk about the effect on the cells, like on the muscle cells and the say the buildup of fats, but also the cell structure that you found in your research, and what happens when we eat certain types of fat.
Yeah, we are what we eat, and that's literal. So the type of fat that we eat becomes an integral part of our cell membranes. If you remember from biochemistry, our cell membranes are made of phospholipid bilayer. So there are some fats that are embedded in the cell membrane. And if we eat a lot of animal foods that contain saturated fat, then we will have a lot of saturated fat in our cell membranes. Now, saturated fat will make the cell membranes more rigid and less flexible. In contrast to polyunsaturated fats that are found in plant foods, which will make the cell membranes more flexible and more fluid. And this has major implications for metabolic processes, such as insulin signaling. The insulin receptor is right there in the cell membrane. So the composition of the cell membrane affects also how the insulin signaling works. So if you have a lot of saturated fat in your cell membrane, this will cause insulin resistance at a cellular level. Now, in our research, we asked ourselves a question. So if you switch to a completely plant-based diet and you eliminate most of the saturated fat in your diet and you only consume polyunsaturated fat, can you change the composition of the cell membrane? And we tested it out in our participants with type 2 diabetes. We had 74 patients with type 2 diabetes. We brought them in and randomized them into either a plant-based diet or a hypocaloric diet recommended by the American Diabetes Association, which was a hypocaloric diet. So the energy content of the diets was comparable. And we were also looking at the cell membrane composition. And we found out that a plant-based diet increased the content of linoleic acid, which is one of the polyunsaturated fatty acids found in plant foods. And this increase in linoleic acid in cell membranes also correlated with an increase in insulin sensitivity and a decrease in visceral fat. So the metabolic changes were directly related to these changes that were occurring in the cell membranes. Now, diabetes has a very specific signature on the cell membranes that's composed of low proportion of linoleic acid and a high proportion of palmitate, which is a saturated fatty acid. So after switching to a plant-based diet, when we increase the linoleic acid content in the cell membranes, we basically completely changed the signature on the cell membranes. The signature is so powerful that it's able to predict the development of type 2 diabetes by about 5 to 10 years. So changing this specific signature has major implications for the future life of our study participants. So it's really good news. You can change, some changes that occur even at cellular level through the changes in your diet.
Yeah, and talking about the cellular level, I think you also looked at how a whole food plant-based diet could actually improve beta cell function. And I know one of the things for people who have had type 2 diabetes for a long time is that they might have actually done a lot of damage to their beta cells, but I think there was a possibility that they could be improved. Is that right?
Yes, that's correct. It's a billion-dollar industry to find a drug that will improve beta cell function. And we found a way how to improve your beta cell function through diet. How does that sound?
Yeah.
We brought in 75 people who were at risk of getting diabetes. and we were testing their beta cell function. They came in early in the morning, and we gave them a standard breakfast, and we're doing timed blood draws. And we were able to calculate different indexes of their beta cell function. We were measuring their plasma glucose, insulin, and C-peptide concentrations, which enabled us to do mathematical modeling of their beta cell function, of their ability to secrete insulin according to the body's needs, according to the plasma glucose levels. And we found out that after 16 weeks on a plant-based diet, the insulin secretion went up in all glucose levels. So people were able to secrete more insulin compared with their baseline, while in the control group, there was no significant change. So this was a really significant finding, that a diet may play a key role and may be used in the prevention of the development of type 2 diabetes.
Yeah, and I guess it goes with the, the saying that the body is always trying to be in a healthy state. And if we just give it the right fuel, then it'll do the things that it needs to do. I'm wondering as well if we could, what I'm thinking of is when I looked at your talk on this metabolic magic, was if somebody goes on a hypocaloric diet, but say the composition is what's recommended by the ADA, 40 or so percent carbohydrates, and then the rest from fats and protein. When you go on that diet, can actually be nutrient deficient, and you're getting a lot of saturated fat and cholesterol and things that end up giving this negative cascade metabolically. Like, you were talking about how we've got our satiety signals that are triggered by the food that we eat, our gut microbiome, and then even at the cellular level, the fats that we eat get incorporated into the cell membrane. So from what you've researched, do you find that, just the foods that we should be eating, the like whole plant foods, they create like this more positive cascade that affects a lot of things, that they're all connected kind of, and that's where the magic comes in?
Yeah, exactly. If you need to lose weight, there are so many ways how to do it. And obviously, eating less calories is one of the mechanisms. But still, you can be on a very unhealthy diet, even if you restrict your amount of calories. Potentially you could be losing weight eating only cookies, for example, but obviously these don't provide any micronutrients that you need. So even though you would be losing weight eating only cookies, it's not the healthy way how to lose weight.
Right.
So you need to be considerate. And a plant-based diet is a very healthy way how to not only lose weight, but improve your overall health, decrease your cardiovascular risk, decrease your cholesterol levels, and your diabetes risk, and your risk of getting cancer. It improves the blood flow, so it improves the brain function. You will feel better. The quality of your life will improve. So it's not only about changes on the outside, how you look like. It's not only about the changes on your scale. It's also about your body composition, where you're losing the visceral fat, the most metabolically dangerous fat, and you're gaining muscle relatively compared with fat. But it's also about the changes at the cellular level. Your metabolism improves when you consume a plant-based diet.
Yeah.
So I'd like to encourage everyone to give it a try, how it feels like.
Yeah, I think that's a great thing, and everybody should definitely give it a try. Um, so I also want to mention, like, in terms of, like, say somebody was eating just cookies to lose weight. I think there was a study by Kevin Hall. I think that's his name, and he works at the NIH, and he looked at the ketogenic diet and found that um, in terms of weight loss, like, people would lose weight initially, but what they were losing was water weight and then some protein. And they really weren't losing the body fat. That's what they wanted to lose. And then after some time, it kind of peters off. And this is like uh, the diets, why diets don't work and why people go on a diet and they'll lose some weight, but then they'll gain back twice as much or three times as much. And I think it's like with your studies, when you look at the mechanisms and you go on a hypocaloric diet that's also nutrient deficient, your body feels like it's in starvation mode. So then when you get food, it just wants to hold on to it more because it feels like you're going to go into starvation again.
Yeah, absolutely. And another thing to consider when we're talking about keto diets is the long-term risks. It has been shown, large prospective studies have shown that people on low-carb diets have a higher risk of dying sooner, um, mainly because of heart disease and cancer. So if you'd like to die sooner, by all means, go on a keto diet. But if you want to be healthy, just consume a healthy diet that's plant-based that will provide all the health benefits, not only the weight loss.
Right. And I think the other amazing thing too is I remember seeing a talk by Dr. Michael Greger on food synergy and how if you're looking for the benefits of, say, broccoli and red grapes, and if you eat them together, you aren't just doubling the benefits, you're actually exponentially increasing it because of the way food synergistically reacts in our bodies.
Mm-hmm.
You mentioned cancer, and yesterday was World Cancer Day, and I wonder if you could tell us anything about mechanisms that you know of in terms of what are activated with nutrition with some cancers.
We know that people consuming plant-based diets have lower risk of breast cancer, colorectal cancer, and prostate cancer. There's also some research showing that plant-based diets can improve the survival and can even reverse some initial stages of these cancers. The mechanisms that are involved are fairly complex. However, there's a clear synergy. Plant-based diet contains a lot of antioxidants that will help us fight the oxidative stress. Ideally, the free radical formation should be counterbalanced by antioxidant action in our body. However, in many diseases, like diabetes or cardiovascular disease or cancer, the free radical formation is far more expressed compared to what the antioxidants can do. So it's especially important that in these diseases we emphasize the consumption of antioxidant-rich foods, of whole food, plant-based diet that will provide all the antioxidants to fight the oxidative stress.
And would you consider, like, if somebody would they be looking at certain things like superfoods, or what kind of foods on the whole, like, would it be all of the whole foods, like the whole grains and the legumes and any kinds of fruits and vegetables?
There are many phytochemicals contained in plant foods. So we can measure some of the antioxidants. For example, strawberries have been shown to be one of the richest sources of antioxidants. But if you eat a variety of plant foods, you can be sure that there are some phytochemicals in each food that are beneficial. So it's not only about consuming one specific food, it's about consuming a large variety of foods that provide you with all the benefits.
Great. And I wonder if you could tell us a bit about why you decided to go into this field of study.
I find it completely fascinating. I'm an endocrinologist by training, and during my endocrinology training, I was really disheartened by the reality in the hospitals, where people with diabetes get a diet that doesn't really make their diabetes a lot better. Maybe a little bit, but it doesn't really solve the problem. So I thought, this is just not working. And I didn't want to be a doctor who would just prescribe the same thing all over again, even if it's not working. So I was thinking about ways how to really help the patients that were coming to my practice. And that's why I decided to do a study comparing a plant-based diet with a standard recommended diabetic diet. And we showed that a plant-based diet is twice as effective for weight loss and for diabetes management, for glycemic control, and for improvements in insulin sensitivity compared to the standard recommended diet by the American Diabetes Association. And that's really good news for all patients with diabetes. You don't need to settle for diabetes. You can fight it through your lifestyle choices. And it's completely worth it, even though some people may think, well, of course it worked, but it's so hard to switch to a plant-based diet. It may be easier than you realize. It's only about your flexibility and about your willingness to learn a new recipe, and you will discover that it's so delicious and it's very easy to be on a plant-based diet, and it's so much fun. It's also about getting some new skills, and you would also get to know new people and new foods, and you would completely enjoy it. So if you have diabetes and would like to reverse it rather than only manage your diabetes, then by all means you should try a plant-based diet.
Mm-hmm. And again, with the managing the diabetes, in terms of the medications that are used, such as the diabetic pills, sulfonylureas, and insulin injections, they haven't really, at least from what I've researched, they haven't really shown to be very effective. And I wonder if you could talk a little bit about those. Like, I know one of the side effects for taking insulin is actually it will encourage weight gain instead of weight loss, which could help a patient with diabetes to reverse their diabetes if they were able to lose extra weight. But there are other things as well, like in terms of what you mentioned earlier, some cardiovascular events. But I wonder if you could tell us a little bit more about that.
Yeah, a plant-based diet is the only diet that has been shown to reverse cardiovascular disease. Not only manage it, but reverse. Mm-hmm. In patients who were, on a waiting list for surgery, for heart surgery, Dr. Ornish was able to show that a plant-based diet is able to reverse atherosclerosis. Mm-hmm. And that's again a very radical approach. Instead of only settling for, managing heart disease, we can just go for it and we can reverse it completely.
And talking about like the magic pill, and people are looking for something. Basically, they want to get the most bang for their buck, right? So that's why I think a magic pill is so attractive. But how long does it take, in most cases, say for type 2 diabetics, to get improvement, and for like heart patients as well? Like, do they have to wait for a year, or does it depend on the person?
The initial changes in metabolism may be pretty fast. It may take only a few days. In fact, the plant-based diet is so effective and so efficient that we may need to decrease diabetes medications within a few days on a plant-based diet. And of course, these benefits continue, even throughout, several weeks and months as people are losing weight and improving their metabolism further. But some of the benefits may be experienced within a few days. For atherosclerosis and heart disease, it may take longer, although it's kind of similar to diabetes. Some of the symptoms may disappear or improve fairly quickly. Within a few days or weeks, people may experience that their breath is becoming better. They don't have as much chest pain. But to see the quantitative changes on a CAT scan, for example, it takes months. Mm-hmm. So you need to stick to the diet for a longer time.
Right.
But you get some benefits within days that will encourage you to stick to the diet and just, continue.
Yeah. I guess people start to feel a lot better and notice that they can do more, they can move around more and with much more ease.
Mm-hmm. Yes, absolutely. And it's also about how you feel and about the quality of your life. Mm-hmm. And if you haven't tried it, you don't know what you're missing out on.
So Dr. Kahleova, what do you like to eat during the day?
So an example of my breakfast would be, for example, cooked millet with fruit and nuts. I like to eat a lot of berries for my breakfast. So I eat a whole bowl of berries almost every morning, and some bananas and some nuts, and some whole grains. Like, for example, cooked millet is one of my favorites. For lunch, it may be a bean burrito, for example, or beans and rice. I love beans and lentils. So very simple foods, beans and rice or lentils with a vegetable salad. And for me specifically, I eat only 2 meals a day. So I don't eat anything for dinner. I eat only breakfast and lunch because I introduce also intermittent fasting on a daily basis. But for people who would like to have some dinner, it may be, for example, pasta with marinara sauce and basil. It may be just a big vegetable salad that will not fill you up too much before you go to sleep. And it's also, although you may eat as much as you want on a plant-based diet, it's better not to snack too much. It's better to stick just to 3 meals a day, breakfast, lunch, and dinner, rather than snack in between. If you snack in between, you disrupt your metabolism, and it's not good for your overall health. But of course, if you're hungry, if you didn't have enough time to eat your breakfast, You shouldn't feel constricted, but you shouldn't just snack on a regular basis.
I saw your presentation on the on eating times and how to fix your what was it called, the clock. And I wonder if you're familiar with in Chinese medicine, they have they say that every organ in your body has a specific time throughout the day that it does its work. So they also recommend that the best times for you to eat are like you can have breakfast and you can have lunch, and it's usually nothing later than around 4 or 5, and that gives your other organs that work later in the nighttime when you're sleeping, it gives them a chance to work effectively. Are you familiar with that?
Yeah, absolutely. And we know from large prospective studies that people who consume large breakfast have better weight management than people who are skipping their breakfast. We know that the same meal eaten in the morning hours doesn't have the same metabolic effects compared with the same meal eaten in the evening. In the evening, you deposit a lot of more fat compared to the meal eaten in the morning because the hormone secretion is completely different. And all these studies show that our ancestors were very clever when they said, eat breakfast like a king, lunch like a prince, and dinner like a pauper. Our current research is just confirming that they were wise, and that we should also listen to them.
And I guess on the whole food plant-based diet, I mean, it's kind of hard for somebody if they're not on a whole food plant-based diet to imagine that they could be full, once they're done eating lunch, that they could be full for the evening. But I wonder if you could tell us again about what are the things about foods that will keep you full and satisfied for a long period of time.
So generally speaking, fiber fills you up. So you need to be careful about consuming unprocessed plant foods. And if you eat a lot of vegetables, you may need to also add some more beans that will not only fill you up, but also keep you full for a longer time. You may want to add some whole grains that will stabilize your blood sugar and will release the glucose in your blood, not at once, but gradually, so that your blood sugar is constant and your brain has a constant supply and can work well.
So, so if somebody say, so those foods are kind of like starches, the legumes, whole grains, maybe some root vegetables like potatoes and sweet potatoes that give you really that sense that you're full, that you're satisfied, and that releases the glucose into your bloodstream slowly. I suppose, so what happens to glucose when it goes into your body? If you're not using it, there is some that's stored as glycogen in the muscles, cells, and in the liver. And it only stores a certain amount, and then some is also burned off as heat. Is that right?
Yeah, that's correct. Mm-hmm.
Okay, yeah. So I guess then, does your body, if it only stores that certain amount, then you kind of want to have that slower release of glucose throughout the day to kind of regulate that, I say, energy usage?
Yeah, absolutely. It's a wise use of energy.
Okay, yeah.
Release it slowly.
Yeah, I was just wondering because I was just meditating on and trying to figure out if that made sense. Yeah, well, let's see if I have anything else to ask. I think we've got it all covered, and we got it all covered really quickly.
Wonderful, wonderful. Yeah. Well, thank you so much for taking the time for this wonderful interview, and I hope the people who are listening will benefit from it and will make dietary changes to also experience the benefit of plant-based diets.
Yeah, thank you very much, Dr. Kahleova, and I hope you have a wonderful day.
Thank you. You do.